Hello, I am Dr. DeAndre. Today I will talk about an important and increasingly discussed question. Can lack of sleep increase cancer risk? This topic is gaining attention because modern lifestyles are changing how people sleep. Many individuals are now sleeping fewer hours, experiencing poor sleep quality, or maintaining irregular sleep schedules. Sleep is not simply a period of rest. It is a critical biological process during which the body repairs tissues, regulates hormones, and supports immune function. When sleep is disrupted or insufficient over long periods, these essential systems may not function properly. Scientific research suggests that chronic sleep deprivation may be associated with an increased risk of certain cancers, including breast, colorectal, and prostate cancers. This relationship is not caused by a single mechanism. Instead, it involves a combination of hormonal imbalance, reduced immune efficiency, and increased inflammation. For example, individuals who consistently sleep less than 6 hours per night often experience elevated stress hormones such as cortisol. At the same time, protective hormones like melatonin may decrease. This imbalance can influence how cells grow, repair, and respond to damage. Patients often underestimate the importance of sleep because its effects are gradual and not immediately visible. However, over time, chronic sleep deprivation can contribute to metabolic disorders, weakened immunity, and increased disease risk. In this video, I will explain the scientific connection between sleep and cancer, the biological mechanisms involved, and practical strategies to improve sleep quality. Understanding these factors can help you make informed decisions that support long-term health. Sleep plays a fundamental role in maintaining the integrity of your DNA. Every day, your body produces millions of new cells, and during this process, small errors can occur in the DNA. Under normal conditions, the body has repair mechanisms that identify and correct these errors. During deep sleep, the body activates genes responsible for DNA repair and cellular maintenance. This is when damaged cells are either repaired or removed before they can multiply. This process is essential in preventing the development of abnormal cells that may lead to cancer. When sleep is insufficient, these repair systems become less effective. Studies have shown that sleep deprivation can reduce the activity of genes involved in DNA repair pathways. This means that damaged cells may survive longer and continue to divide. Over time, the accumulation of these damaged cells increases the risk of cancer development. In addition, lack of sleep increases oxidative stress, a condition where harmful molecules called free radicals damage cells. Oxidative stress is a known factor in cancer progression because it contributes to DNA mutations. Patients who experience chronic sleep deprivation often report fatigue, poor concentration, and reduced productivity. While these symptoms may appear mild, they indicate deeper biological disruptions. Maintaining consistent, high-quality sleep allows the body to perform these critical repair functions efficiently. This reduces the accumulation of cellular damage and supports long-term health. Melatonin is a hormone produced by the pineal gland in response to darkness. It regulates the body's sleep-wake cycle and plays a significant role in protecting cells from damage. Melatonin functions as a powerful antioxidant, helping to neutralize free radicals that can damage DNA. It also influences the immune system and helps regulate hormones such as estrogen. This is particularly important because elevated estrogen levels are associated with an increased risk of breast cancer. When sleep is disrupted, especially due to exposure to artificial light at night, melatonin production decreases. Lower melatonin levels reduce the body's ability to protect cells from oxidative stress and DNA damage. Research involving night shift workers has shown a higher incidence of certain cancers. One proposed explanation is long-term suppression of melatonin due to exposure to light during nighttime hours. Patients who frequently use electronic devices before sleep or sleep in brightly lit environments may unknowingly disrupt their melatonin production. Even small amounts of light can affect hormone levels. Improving sleep hygiene can help restore natural melatonin production. This includes reducing screen time before bed, maintaining a dark sleep environment, and following a consistent sleep schedule. Supporting healthy melatonin levels is an important step in maintaining cellular protection and reducing long-term cancer risk. The immune system is one of the body's primary defenses against cancer. It constantly monitors the body for abnormal cells and works to eliminate them before they can develop into tumors. During sleep, The immune system becomes more active in producing protective cells, including natural killer cells. These cells are responsible for identifying and destroying abnormal or damaged cells. Sleep deprivation has been shown to reduce the activity of these immune cells. When natural killer cell activity decreases, the body becomes less effective at detecting and eliminating potential cancer cells. In addition, lack of sleep increases the production of inflammatory markers such as cytokines. Chronic inflammation creates an environment that supports cancer growth and progression. Patients who do not get enough sleep often experience frequent infections or slower recovery from illness. These signs indicate weakened immune function. Over time, reduced immune efficiency, combined with increased inflammation, can significantly increase the risk of disease, including cancer. Ensuring adequate sleep supports immune strength and enhances the body's ability to defend itself against abnormal cell growth. Sleep deprivation affects not only the immune system, but also metabolism and overall lifestyle. These changes can indirectly increase cancer risk. Lack of sleep disrupts hormones that regulate hunger, such as ghrelin and leptin. This imbalance often leads to increased appetite and higher calorie intake. As a result, individuals may gain weight over time. Obesity is a well-established risk factor for multiple types of cancer, including breast, colorectal, and pancreatic cancers. Excess body fat promotes inflammation and alters hormone levels, creating conditions that support cancer development. Sleep deprivation also affects glucose metabolism, increasing the risk of insulin resistance. Elevated insulin levels can promote abnormal cell growth and proliferation. Patients with irregular sleep patterns often report fatigue, reduced physical activity, and poor dietary choices. These lifestyle factors combine to increase long-term health risks. Improving sleep habits can positively influence metabolism, reduce weight gain, and lower inflammation. Maintaining a consistent sleep schedule is an important step in reducing these risks and supporting overall health. Improving sleep quality is one of the most effective ways to support overall health and potentially reduce cancer risk. Experts recommend maintaining a consistent sleep schedule by going to bed and waking up at the same time each day. This helps regulate the body's internal clock. Creating a sleep-friendly environment is also important. This includes keeping the room dark, quiet, and at a comfortable temperature. Reducing exposure to screens before bedtime can help maintain melatonin production. Blue light from devices can interfere with the sleep cycle. Limiting caffeine intake, especially in the evening, can improve sleep quality. Regular physical activity during the day also supports better sleep at night. Patients who adopt these habits often report improved energy levels, better concentration, and overall well-being. Consistent sleep of 7 to 8 hours per night is generally recommended for adults. Small, consistent changes can have a significant impact on long-term health. In summary, sleep plays a critical role in maintaining overall health and protecting against disease. Chronic lack of sleep can affect DNA repair, hormone balance, immune function, and metabolism. These changes do not directly cause cancer, but may increase the risk over time by creating conditions that support abnormal cell growth. It is important to understand that sleep is not optional. It is a fundamental biological need that supports every system in the body. Making sleep a priority is one of the simplest and most effective ways to improve long-term health. If you experience persistent sleep problems, it is important to consult a healthcare professional for proper evaluation and guidance. If you found this information helpful, consider sharing this video and subscribing for more evidence-based health content.